Welcome to Module 3. This is a longer module and covers the three main screening programmes in the UK: breast, cervical and bowel cancer. Let's increase our understanding of these cancers and understand why a screening programme is so necessary.
Specific screening programmes. Let us now look in a bit more detail at some of the specific screening programmes available. Screening programmes don't look for all cancers, but some have proven very cost effective and might mean that many people can be screened at low cost, but the pick-up cancer rate is high. We will discuss bowel, breast and cervical screening in turn. A lot of cancers have no screening programmes because there are no tests necessarily to detect the cancer at an earlier time point, or the test is too expensive, or it comes with its own risks. So that's why we don't screen for all cancers, where some people may feel that we should be. We will now discuss bowel screening. So what is bowel cancer? The reason we screen for it. Why do we need to screen for it? Who is screened and what is the uptake of bowel screening? And how do we screen for it? What is bowel cancer? Bowel cancer is cancer that arises within the bowel, more commonly in the large bowel down to the rectum. It usually starts as an abnormal cell that grows into a polyp that grows into a cancer. The reason it can be picked up early is that we can detect blood in the stool, which is the initial stages of bowel cancer. Bowel cancer is extremely common and one of the four most common cancers in the UK. It's the second leading cause of cancer death, with approximately 16,000 deaths per year. 1 in 14 men and 1 in 19 women will be diagnosed with bowel cancer during their lifetime. Over 41,000 people are diagnosed with bowel cancer every year in the UK. 8 out of 10 people who are diagnosed with bowel cancer are over 60. And finally, people with a family history of bowel cancer have an increased risk of developing the disease. The signs and symptoms of bowel cancer. Initially, there are no signs or symptoms of bowel cancer, and hence it can be picked up at a very early stage. As the cancer becomes more advanced, the symptoms start to appear, but it does take quite a while, years in fact, to go from the early stages of bowel cancer to more advanced disease. The signs and symptoms of bowel cancer include bleeding from the bowel or from your bottom, change in bowel habits, severe tummy pain, a lump in the tummy, or anemia, so feeling tired for no reason. The bowel screening process. So what do you need to know? Bowel screening using a test on your stool is offered every 2 years for men and women aged 60 to 75 years. A bowel scope screening programme is in the process of being rolled out to all 55-year-olds in England. Clearly, it has been proven that bowel cancer can be picked up at an early stage, and when diagnosed early, it makes a massive difference in terms of outcome to that person. It really can cure people of their cancer when it is picked up early. So, what is the process? You'll get an invitation and card sent to your house. You then take a sample from the stool. And what we've found is, for every 1,000 cards that are returned, 20 people have blood in their sample, and 16 people from this 20 need to see their nurse or health professional. So it's really important to remember that really early diagnosis does save lives, and therefore the screening programme is part of this early diagnosis. The colonoscopy. So for all these people that end up having to see a health professional. As we said, that's 16. So for every 16 people that have a colonoscopy, 8 will have no cancer. 6 will have polyps that could turn into cancer, and 2 actually do have cancer. So a colonoscopy is a tube that is passed up the back passage so the bowel can be directly visualised and a sample taken when needed. It's a very simple procedure and provides lots of information, but some people find the thought of it very embarrassing. However, the people who do these do them day in and day out and are so used to doing it that it's not embarrassing to them at all. So hopefully they can put you at ease. But from these figures, you can see how important it is to do it. Let's now look at the breast cancer screening in a bit more detail. What is breast cancer? Why do we need to screen for it? Who is screened? And how do we screen for it? The incidence of breast cancer. Breast cancer is another extremely common cancer, and in fact is the most common cancer in the UK. Remember, whilst 1 in 8 women will have breast cancer in their lifetime, some men can develop it as well. Over 55,000 people are diagnosed with breast cancer each year in the UK. 23% of cases are preventable. People with a family history of breast cancer have an increased risk of developing the disease and potentially will develop earlier, so it's important to remember this and be breast aware. So what is breast cancer? Breast cancer is a kind of cancer that develops from breast cells. Breast cancer usually takes off in the inner lining of milk ducts or the lobules that supply them with milk. Over time, a malignant tumour can spread to other parts of the body if it is not picked up early and dealt with. The signs and symptoms of breast cancer. Here are the signs and symptoms of breast cancer that you should be aware of, especially if you're involved in intimate care. Breast lump or thickening of the breast tissue, pain in the breast or armpit, puckering or dimpling of breast skin, change to the nipple becoming inverted or changing in shape or discharging. But again, remember the screening programme is designed to pick up breast cancer before the symptoms arise. Breast screening. Breast screening is an important programme and takes place in either a hospital or a mobile unit. As it is offered every 3 years to women aged 50 to 70 years old, the programme is in the process of being extended as a trial to invite women aged 47 to 73. Some women will be diagnosed and treated for breast cancer that would never otherwise have been found and would not have become life-threatening. This is the main risk of screening, although it is better to have an abnormality dealt with and not left to its own devices. Non-invasive breast cancer. About 1 in 5 women diagnosed with breast cancer through screening will have non-invasive cancer. Invasive breast cancer. About 4 in 5 women diagnosed with breast cancer through screening will have invasive cancer. Cervical cancer. Cervical cancer is another cancer that is screened for. Let's look at cervical cancer in a bit more detail. What is cervical cancer? What are the symptoms of cervical cancer? Who is screened for it? Why do we need to screen for it? And how do we screen for it? What can we do? Incidence of cervical cancer. Since the early 1990s, cervical cancer incident rates have decreased by a quarter, which is 25%, in females in the UK. Cervical cancer incident rates are likely to fall in future decades, according to the projections accounting for the expected impact of HPV vaccination. Over 3,000 women are diagnosed with cervical cancer every year in the UK. 99.8% of cases of cervical cancer are preventable. Cervical screening is offered once every 3 years to women aged 25 to 49 years, and once every 5 years to women aged 50 to 64 years. The facts. 99.7% of cervical cancers are caused by persistent high-risk HPV infections, which cause changes to the cervical cells. These abnormal cells found through cervical screening, or a smear test, are not cancerous, but given time, often years, they may go on to develop into cancer. The signs and symptoms of cervical cancer are abnormal vaginal bleeding, such as after sex or bleeding after the menopause, bleeding and spotting in between periods, or an unusual discharge from the vagina. Top tips. Here are some top tips that you should consider when talking to someone about cervical screening. Ask them what sanitary protection they use. If someone is using tampons, they may find it easier as they will understand where the speculum is going. You show them the physical position that the patients will need to adopt. They can be then practiced at home until it feels a bit less awkward. And if you show them the speculum and use it so that they are familiar with what it looks like and the noise it makes, the more exposure someone has had to the clinic, the procedure and the health professionals, the lower the barriers will be.